Hello students, today I am going to tell you about fluorine toxicity in animals, how the fluoride compounds causing the toxicity in livestock. Generally, fluoride compounds are present all over the matrices like water, soil, rock, mountain, rock phosphates and the many plants which have the concentration of fluoride compounds inside the body, especially the legumes. Legumes plant have the rich concentration about fluoride compounds. Many industrial pollutions which are making the ascaricides and anti-helminthics like sodium fluoride, sodium fluoroacetate and the fertilizer making factories. When the particular animals are residing nearby the area of factories, they may suffer from the fluoride toxicity or fluorine toxicity. So generally for whole life, throughout whole life, the animals consume the fodder materials which have a little concentration of fluorine, but they may cause they do not show the fluorine toxicity because of the low concentration and they excrete out. However, when the incidentally they ingest the fluoride compounds in high concentration for a prolonged duration, they may suffer from the fluoride toxicity, like the animals who, nearby the area of factories which making the particular fertilizers and the anthelmintics which have the fluorine composition. So we can say there is very rare chances of fluorine toxicity in acute case, but in dairy animals, in younger calves, the fluoride toxicity of chronic fluoride toxicity, you can say fluorosis, may occur frequently, but acute cases is very rare. But in case of pig, sometimes acute cases occurs in pig. So first of all, what are the causative agent of the fluorine toxicity? So constituent, I already told you that the industrial pollution, the plant legumes which have the fluoride compounds, and the rock phosphate, and the water which have high concentration of the fluorine. If they consume for whole life, they consume for a prolonged duration in high concentration, the fluoride compound accumulates in the body tissue. If a high level of body tissue deposited or accumulated inside the body, especially in bone and teeth, both tissues, bone and teeth, may accumulate fluoride compounds accumulates more than 95% inside the body. So acute cases is rare, but chronic cases of fluorine toxicity occurs commonly in mostly dairy animals. But in the case of chickens, and they have a power of tolerance of the from the fluorine, and they may resistant or somewhat least sufferer. So first of all, these are the causative agent of the fluorine toxicity in livestock. Now what about the toxicokinetic? The particular I have told that acute toxicity in livestock for the fluorine may occur very rarely. If they occur, they may die without showing any symptoms. Like pig, if suffer from the ingest a lot of concentration, if ingest from the industrial pollution or other source, they may suffer from acute case and they may die. And the particular the clinical sign about acute toxicity, they causing the highly irritant nature of fluorine. They cause the highly gastroenteritis, and they may increase the permeability of blood vessels, and they may cause the hemorrhage, hyperemia and edema of the body. So generally I told that acute cases is rare. Now what about the chronic cases? Chronic cases is common in dairy, particularly dairy cattle. Chronic cases means when a little or high concentration the particular livestock consumes for a prolonged period, month or years, they may show the chronic toxicity, and these fluoride compounds may deposit in the bone and tissue. These two tissues, these two parts showing much concentration, more than 95% of fluoride compounds deposited or accumulated in the bone and teeth. So about clinical sign in acute case, there is nothing, but in chronic case, the exact mechanism, toxokinetic mechanism is not clear. But some author reported that these fluorine compounds or fluorine may interfere with the calcium ions. They interfere the calcium ions, and they may gradually decrease from the body and as well as from the bones and teeth. So ultimately, if they interfere with the calcium metabolism, they may cause reduce the calcium, and they may cause the improper mineralization of bone or improper matrix of the bone. Particular bone matrix may improper and maybe disorder of the matrix occur. So generally, and some authors also reported that the particular fluoride compounds also interfere with the proteolytic enzymes, or you can say phosphatases, which may also help in the formation of bone and teeth. They also interfere in the particular enzyme system, proteolytic enzymes, which help in the formation of bones. They also interfere, and ultimately what are the consequences? That is the deformity of bone, demineralization of bone, reduced matrix of bone or bone and in the teeth occur. So this is the toxokinetic. What is the mechanism of the fluoride compounds, how they cause. Now what about the chronic toxicity, the main toxicity of the fluorine, or you can say fluorosis, how fluorosis occur. So we may divide fluorosis in two types, because the more than 95 or 98% they accumulates in the bone and teeth. The most affected part is the bone and teeth. So we will discuss about first dental fluorosis, and second one osteofluorosis. So in the case of dental fluorosis, when more than a long period, more than month and years, the affected animal consume the fluoride compounds, they may show the symptom of dental or osteofluorosis. In case of dental fluorosis, the mottling of teeth occur. In start phase, the mottling of teeth and some pink and greenish spots in the teeth occur. However, gradually when the particular toxicity increases, the black spots become very dark in color, and the a peculiar sign of the dental fluorosis is that a horizontal band, a horizontal black or brown spot band across the teeth occur in the dental fluorosis. And ultimately, after in worse condition, they may break fracture of the teeth occur, and gradually the shedding of the teeth occur, and the gap between two teeth and the gap between the gums occur. So and very painful condition, then in between teeth or in gums, very painful conditions occur. So because of pain, the animals refuse the feed materials, refuse the food materials, and they may show the anorexia, emaciation, and ultimately death if the condition is not eliminated. So in the dental fluorosis, the very painful condition, and some spots, black spot horizontal across over the teeth, blackening of teeth, mottling of teeth, very white and chalky appearance of teeth occur. In the case of also bone, white and chalky appearance occur. In shedding of teeth, and the gap between teeth occur in dental fluorosis, and they may refuse the food material. Now what about the osteofluorosis? In case of osteofluorosis, there is already I told that they interfere with the calcium metabolism. They may interfere with the calcium ions. They may show the that disorder of the bone. You can say the exostosis of the bone. Generally the hip joint, then hind limb, these parts are first affected by the fluorine toxicity in the case of that osteofluorosis case. After all, the ribs, sternum, everything affected, and they may show lateral exostosis, or you can say the hyperplasia, and the exostosis of mandible bone occur also in the case of bone. And from gross lesion, you can say the exostosis, the bones are really from lateral side, they may enlarged. So in osteosis, disorder of bone occur. Finally, the lameness and other locomotor system are from the locomotor system totally affected. Now what about the these are the toxokinetic, these are the clinical signs and the symptoms about fluorosis, chronic fluorosis. Now what are the diagnosis process? You can diagnose if the animal find affected. You can take history, clinical signs and other routine examination as guidelines of the diagnosis process. Now what about the x-ray? X-ray can give the clear cut diagnosis about the fluorine toxicity of the bone and teeth. If you get the x-ray of the bone, there may be dismineralization or there is improper mineralization or there is improper matrix of bone occur. In microscopically when you diagnose, then also give clear cut diagnosis because of the matrix already disorder of matrix occur inside the bone and teeth. So these are the confirmatory diagnosis process. And by the fluoride assay, you can also go for the fluoride assay in feed and the particular fodder materials and the inside the body. You can take the assay of fluoride and get the confirmatory process of diagnosis about the fluoride toxicity. These are the diagnosis process. You can differentiate it from the vitamin D, vitamin A deficiency and many other locomotor or teeth deficiency disorders. These are the diagnosis and differential diagnosis. And now what about clinical now what about line of treatment? The line of treatment, there is no specific antidote. There is no any remedy for the fluoride toxicity. You may give the supportive and the symptomatic treatment. You can give the symptomatic and supportive treatment. First you may eliminate the source of the cause. You may eliminate the fodder material, feed material where the animal are already exposed or they consuming the water, feed or industrial pollution. Now what you can give intravenous glucose, intravenous calcium, because they interfere with the calcium. You can give also you can also give the animal, affected animal, that one vitamin D. You can give some analgesic because they are suffering from a lot of pain in dental and osteoporosis. You can give the analgesic. And symptomatic, you can give the antibiotics. You can give the steroids because of the when you give the steroid, they may also make the maintenance of the bone tissue and teeth, and they may regenerate these tissue. So you can give also the steroids. You may try home remedy. You can give the milk which contain calcium, and when you give milk, they interfere with the calcium metabolism and they may excrete from the body fluoride compounds. Some may reduce from the body and toxicity recover. You as a main treatment, you can give the calcium gluconate intravenous, or magnesium hydroxide or calcium gluconate you can give, because when these calcium gluconate interferes the calcium in the intestinal mucosa, and they get reduced and they get excreted from the body, and toxicity may recover. Otherwise there is very poor prognosis, very guarded prognosis about the fluoride toxicity. The treatment is very poorly in the case of fluoride toxicity. So you may try these calcium gluconate, vitamin D, analgesic, steroid and other things for fluoride toxicity. Now this is all over about the fluoride toxicity in livestock. If any query, you can ask to me. Thank you.